Hello ma'am, good afternoon. I am Aday Jean Perez, a student nurse from APCAS and I am your student nurse for today. So, kamusta po kayo ngayon?
Okay naman po.
So, narito po ako upang magtanong ng ilang mga katanungan upang mas maunawaan po namin ang inyong pangangailangan para sa inyong kalusugan at mabigyan po namin kayo ng mas maayos na pangangalaga. So, abutin po ito ng 10 hanggang 15 minuto at nasa sa inyo po kung hanggang saan at kung ano ang mga impormasyon na ibibigay mo sa amin. And may karapatan po kayo na tumanggi sa anumang katanungan na aking ibibigay sa inyo. So, ang mga ibibigay niyo po na impormasyon ay protektado ng Data Privacy Act. At tanging mga healthcare team lamang po namin ang makakaalam nito. So, okay lang po ba yun sa inyo, ma'am?
Opo, okay lang.
So, before we start, our day today is November 27, 2024. Time is 1 p.m. And may I know your name, ma'am?
Stephanie Daisy Lane.
May gusto po ba kayong itawag sa inyo?
Stephanie.
Okay, Ma'am Stephanie, saan naman po kayo nakatira?
Residential Harmony po.
How about your birthday and ilang taon na po kayo ngayon?
18 po. May 29,000.
Gender is female, tama po ba?
Opo.
How about the religion, ma'am?
Roman Catholic.
So, single po ba kayo? Kasal?
Single po.
So, ano po yung trabaho ni Ma'am Stephanie?
Sensei lang po.
So, meron po ba kayong napuntahan na doktor? And kailan po yung last napunta niyo sa doktor?
A year ago na po.
So, bakit po kayo nandito ngayon, ma'am? Ano po yung mga nararamdaman niyo?
Nararamdaman ko
So, punta naman po tayo sa personal health history. So, nung bata po kayo, nagkaroon na po ba kayo ng bulutong, mumps, measles, rubella, rheumatic fever, or polio?
Ano lang po. Chicken po.
So, bulutong po. So, ano naman po yung mga in-inject na po sa inyo na gamot? And kung natatandaan niyo po kung ano po yung date nila, like tetanus, mumps, for measles, chickenpox, hepatitis po, ma'am.
Wala po.
Pneumonia po.
Ano naman po.
Nung nagdaang COVID-19 po, nalagyan po ba kayo or naturukan po kayo ng gamot?
Opo.
Anong gamot?
Pfizer po.
Pfizer. So, kailan po ito, ma'am? Kahit po taon lang.
2022.
2022. So, punta naman po tayo sa allergies and reaction. So, meron po ba kayong mga pagkain or gamot na nagkakaroon po kayo ng allergic reaction?
Wala naman po.
Wala na. So, sa dugo po, ma'am, nasalina na po ba kayo ng dugo?
Hindi po.
So, how about sa surgery, ma'am? Naranasan niyo na po bang magkaroon ng surgery?
Hindi po.
Hindi pa lang. How about hospitalization, ma'am? Na-hospital na po ba kayo before po kayo nagpunta dito?
Hindi naman po.
So, punta naman po tayo sa medical history. So, may nararamdaman po ba kayo na heart disease, hypertension, hypotension, diabetes, cancer, lung disease, gastro-rheumatic? How about stroke po, seizure, glaucoma, or meron pa po kayong ibang sakit? Acidic. So, sa medication naman po tayo. Meron po ba kayong mga iniinom na gamot? Digestive. Yun lang po. So, bakit niyo po iniinom yung digestive na yun? Gano'n po kadalas po siya? Every 4 hours. So, punta naman po tayo sa family health history. So, meron po ba sa pamilya nyo na mayroong hypertension, diabetes, heart disease, tuberculosis, mental health disorders, cancer? How about the bleeding, ma'am? And may nag-inom po ba sa pamilya nyo? So, pwede ko po ba malaman tatay? same lang po. So, ito naman po tayo sa inyong lolo at lola. So, sa mother side niyo po, ang ilang taon na po yung lola ninyo? 78. So, meron po ba siyang sakit? High blood, hypertension. So, about your lolo, ma'am? Ilang taon na po siya and ano po yung sakit niya ngayon?
Namatay siya sa lung cancer.
So, how about sa father side niyo po, ma'am?
So, sa father side ko, yung lola, namatay siya sa diabetes.
Diabetes. How about
Sa
the
father
father?
side ko, yung lola, sa prostate disease po.
So, sa health habits naman po tayo and safety. So, nag-exercise po ba kayo?
Hindi.
Like, how about po yung may hagdan po ba kayo sa bahay? Naglalakad naman po siguro kayo na and papunta po sa school. So, ayan. So, considered po siya as nag-exercise, no? So, how about sa diet, ma'am? Nagda-diet po ba kayo ngayon?
Hindi po.
So, gano'n kadalas po yung mga exercise? Kasama na po ba dun yung merienda? So, ano po yung madalas na kinakain mo? Maalat. So, mataas po yung salt intake niyo. So, sa ano naman po, matatabang pagkain. Mahilig po ba kayo? So, sa kape po ma'am, mahilig po ba kayo? Or ano po yung madalas mong ininom? Tea, cola, coffee, tubig lang po. So, gaano karami po yung coffee yung ininom na tubig per day? So, how about sa alcohol ma'am? Ininom po kayo? So, ano po yung mga ininom niyo? So, gaano po kadalas po kayo? So, alam niyo po ba kung gaano karaming alak yung ininom? So, ay sika po yung sika. So, how about sa may tobacco ma'am? Naninigarilyo po ba kayo? Hindi rin po kayo nag-vape? So, susunod po natin na tanong kasi medyo masaya po siya, no? So, sa inyo po kung susunod po niyo po siya or hindi. Pero mas maganda po siya na susunod niyo po siya para po makatulong po sa health. So, gumagamit po ba kayo ng pinagbabawal na gamot or yung tinatawag po natin yung drugs? How about yung sa needle po, yung pinupusan? So, sa personal safety naman po tayo, no? So, mag-isa lang po ba kayo sa bahay?
Hindi po.
So, may kasama po kayo. So, nakakaranas po ba kayo ng pagkahilo na nagdadahilan ng falls?
Hindi po.
So, how about the vision and hearing loss po? Nararanasan niyo po ba siya?
Hindi rin po.
So, dito naman po tayo sa psychosocial. So, ano po yung mga nararanasan nyo na recent stress po?
Siguro po masyadong madaming kailangan gawin sa school.
Yung mga activities po, no? So, how about the coping mechanism po? Ano po yung ginagawa niya para mabawasan yung stress niya?
Nanonood po, tsaka napadalas po yung pagkain.
So, meron po ba kayong support system? Like, sila po yung nakakasama nyo kapag nababawasan po yung stress nyo?
Family and friends.
Family and friends. So, thank you ma'am. Dito na po nagtatapos ang ating interview. So, meron po ba kayong ibang katanungan?
Wala naman na po.
So, thank you ulit ma'am.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the result will be used in planning further care or treatments.
Good evening, ma'am. I am Princess Eliza Pinoyar, your student nurse for today. May I know your name po, ma'am? Ayo Dennis Carolina. Okay, ma'am. How old are you na po? 18. Okay. When is your birthday, ma'am? January 24, 2006. Okay, ma'am. So for today, I'm going to assess your vital signs. And is it okay for you, for me to touch you? Because sure.
Perform hand hygiene. Provide client privacy. Check the client's temperature with a thermometer. Check the client's respiratory rate in 60 seconds. Check the client's pulse rate within 60 seconds. Check the client's blood pressure using a sphygmomanometer. Document findings in the client record using printed or electronic forms or checklists, supplemented by narrative notes when appropriate.
Okay, Ma'am Aya. So my assessment for you is everything seems normal. Your body temperature is 36.1. Your blood pressure is 110/80. Your pulse rate has 72 beats per minute and your respiratory rate 16 breaths per minute. So everything ranges in the normal. Thank you for your cooperation.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Discuss how the results will be used in planning further care or treatments.
Good afternoon, ma'am. I'm Nicole Ramos, and today I will be assessing your appearance and mental health status. So, before we proceed, can you please state your name and nationality, your age po, and your birthday, and the date?
Step 2. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Observe for signs of distress in posture or expression. Observe general body build, height, and weight.
Ask ko lang po if alam niyo yung height and weight.
Step 7. Observe client's overall hygiene and grooming. Step 8. Note body and breath odor. Observe client's posture and gait, standing, sitting, and walking.
Hi, ma'am. Pwede po ba kayong tumayo? Lakad po kayo papunta dito. Pabalik po. Dito na po tayo. Tapos, taas niyo po yung kanang kamay niyo. Yung kaliwa po. Baba niyo po. Okay. Okay na po.
Document findings in the client's record using printed or electronic forms and checklists supplemented by narrative notes when appropriate.
Prior to performing the assessments, introduce self and verify client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how will the result will be used in planning further care or treatment. Perform hand hygiene and observe other appropriate infection prevention procedures. And provide for client privacy. Inquire if the client has any history of the following: pain or itching, presence and spreading of lesions, bruises, abrasions, pigmentation, spots, previous experience with skin problems in other family members, related systematic conditions, use of medications.
Nagkaroon na po ba kayo ng problema kahit ano pong problema sa balat?
Hindi pa naman.
May allergies po ba kayo?
Wala.
Madalas po bang dry or laging moist ang skin niyo po?
Sakto lang. Minsan dry, minsan nag-moist.
Good evening, ma'am. I am Dorothy Rodriguez, your student nurse for today, and I am assessing your skin, hair, and nails. May I ask, ma'am, what's your name po?
I'm Hailey Rose Factoran,
Age po?
18.
Ma'am, may I ask po kung okay lang po sa inyo dito na lang tayo or private place pa po?
Okay na dito na.
Ma'am, nagkakapasa po ba kayo madalas?
Hindi naman.
Nagkaroon po ba kayo ng pangangati po sa katawan?
Hindi rin.
Inspect skin color best assessed under natural light on areas not exposed to the sun. Inspect uniformity of colors.
Ito na tayo.
Assess edema if present, localization, color, temperature, shape, and degree to which the skin remains indented or repeated when pressed by a finger. Measuring the circumference of the extremity with a millimeter tape.
may be used for a future comparison. Inspect, palpate, and describe skin lesions. Apply gloves if lesions are open, draining, palpate lesions to determine shape and texture. Describe lesions according to localization, distribution, color, configuration, size, shape, type, or structure. Observe and palpate skin moisture. Palpate skin temperature. Compare the 2 feet to the 2 hands using backs of your fingers. Note skin turgor, fullness, or elasticity. By lifting and pinching the skin on an extremity or on the sternum.
Prior to perform the assessment, introduce self and verify the client's identity using the agency's protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the results will be used in planning further care or treatments.
Good afternoon po, ma'am. I'm Teresa Iberleon, your student nurse coordinator. So today po, i-assess po natin yung skull and face nyo para po malaman natin kung may abnormalities po ba or wala.
Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy.
Yung mga data po na makukuha natin is for confidential lang po siya. Yung mga tao lang po sa medical field po yung mga alam natin sa health.
Inquire if the client has any history of the following: past problems with lumps or bumps, itching, scaling, or dandruff, history of loss of consciousness, dizziness, seizures, headache, facial pain, or injury. When and how any lumps occurred, length of time and other problem existed, any known cause of problem, associated with the symptoms, treatment, and recurrences.
Tanong ko lang po if may past problem po kayo ng bukol. Wala. Or pangangati po ng ulo. Wala naman po. Nawalan po ba kayo ng malay nun? Hindi. Nag-seizure po ba kayo? Hindi. Masakit po ulo?
Inspect the skull for size, shape, and symmetry. Inspect the facial features. Inspect the eyes for edema or hollowness. Note symmetry of facial movements. Ask the client to elevate their eyebrows, frown, or lower the eyebrows, close the eyes tightly, puff the cheeks, and smile, and show the teeth.
Ma'am, sa facial movements naman po tayo. Can you lift your eyebrows upward? Then frown po. Close your eyes tightly. Puff your cheeks po. Smile. Show teeth po.
Document the findings in the client's record using printed or electronic forms of checklist, supplemented by narrative notes when appropriate.
Go.
Bale, ito po yung results na nakuha natin. Nung in-inspect po natin yung shape ng mukha nyo, it is round naman po. Yung sa skull nyo po, smooth po siya and contour.
Then, yung in-inspect naman po yung face, it is symmetric. Yung sa eyes nyo naman po, wala naman po siyang edema. Nung in-inspect po natin yung facial features nyo, symmetric naman po lahat. Pantay-pantay po yung paggalaw. Ayun po. Thank you.
Afternoon, I am Aday Jean Veras, a student nurse from APCAS, and I am your student nurse for today. So for today, I'll be conducting an eye assessment to check your structure of your eye and vision. Can you please confirm your name and your date of birth? So the purpose of this assessment is to help us understand your eye health and vision. Right? Do I have your permission, ma'am? So, may gusto po ba kayong itawag ko sa inyo para po mas mapapagod? So, I'm going to sanitize my hand now to prevent the bacteria. So, gusto niyo po ba muna mag-CR, ma'am? Then, I'm going to close your face so that to provide privacy. So, I'm going to ask you some questions, ma'am. So, do you or your family have a history of diabetes,
Wala naman po.
hypertension, or eye conditions?
Wala naman.
So, do you have have you experienced any surgery on your eyes?
Hindi naman.
How about the injury po? So, na-try niyo na po ba magpa-examine sa ibang doctor ng eyes?
Hindi po.
So, do you use any medication such as contact lenses, eyeglasses?
Hindi naman po. Magkano.
So, paano niyo po hindi natulungan ito naman?
Ang ginagawa ko is hindi ako masyado tumutulong kasi po hindi rin ako masyadong merong limit yung paggamit ko ng phone.
So, can you raise your eye? Can you raise and lower your eyebrows for me, ma'am? So, next is I will be checking your eyebrows. And your eyelashes. Oh, can you please look up while I check the white part of your eye? So, ma'am, can you look straight ahead while I shine light on your cornea to check for color?
So,
So, I'll now check your I'll now check your pupils. So, ma'am, can you please straight ahead? Straight. So now I'll shine the light on the other part of your eye to see if it's complete. So focus on the sunlight, then look at the wall behind me, and then look again to the sky. So now can you please look at the sunlight, and then look at the wall behind me, and then look at the So now cover your right eye and look at me. Now please cover your left eye and look at me. Repeat after me. So now, follow this pen light without moving your head. ma'am, focus on the object while I cover your eyes. So now we will gonna assess your near vision. So ma'am, can you read this text?
Connection, preservation, packaging, transit. The victim's physical examination was conducted by Dr. Maramat, who took sample of seminal fluid from AAA for forensic analysis.
Thank you, ma'am. So last, ma'am, pwede po ba kayong tumayo at 36 cm po? And read niyo po yun.
E, F, P, T, O, Z, L, P, E, B, T, E, O, E, D, E, B, F, C, Z, E.
So, thank you, ma'am.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the results will be used in planning further care or treatments.
So today we are going to assess your ears and hearing. So may I know your name po?
Karen yun.
Ilang taon na po si Ma'am Karen?
18.
Kailan po ang inyong birthday?
May 24, 2006.
So, ang result po ng assessment nito is strictly confidential between sa ating dalawa and sa doctor din. Okay lang po po ang
Perform hand hygiene and observe other appropriate infection prevention procedures.
Mag-history sharing muna po tayo, no? So, si Ma'am Karen po ba is may family history na ear problems or ear illness? How about po sa difficulty sa pandemic? May mga tinitake po ba silang gamot? How about po ngayon? Meron po bang ringing noises or may difficulty po kayo sa pandemic? So, start po tayo. Pwede po bang pa-rotate ng head niyo papunta sa left?
Inspect the auricles for color, symmetry of size, and position. To inspect position, note the level at which the superior aspect of the auricle attaches to the head in relation to the eye. Palpate the auricles for texture, elasticity, and areas of tenderness. Gently pull the auricle upward, downward, and backward. Fold the pinna forward. It should recoil. Push in on the tragus. Apply pressure to the mastoid process. Inspect the external ear canal for cerumen, skin lesions, pus, and blood.
Normal naman po na may cerumen, pero rare naman po siya, normal siya. So, sa next procedure po, schedule po natin yung whisper test. Tatayo po ako sa likod nyo, and paki-repeat po yung sasabihin ko muna.
Assess client's response to normal voice tones. If client has difficulty hearing the normal voice, proceed with the following test. Perform the whisper test to assess high-frequency hearing. Ask the client to repeat the phrase. Repeat with the other ear using a different
Ayos
phrase.
naman po nung naririnig niyo po siya ng malas, and naririnig po yung word. So, yung next po natin gagawin is tuning fork test para po ma-define natin kung ano po yung mas malakas na pandinig nyo, kung yung air conducted or bone
Tuning
conducted.
fork test. Perform Weber test to assess bone conduction by examining the lateralization, sideward transmission of sounds.
bandinig niyo, ma'am?
Sa air.
Sa air
Sa
po.
left side.
Okay po. So, document ko lang po, no?
Document findings in the client's record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.
Conducted na pandinig. So, may katanungan po ba kayo, ma'am Haring? So, with result po na to is mapupunta po sa doctor and malaman po natin. At tatawagan ko na lang po kayo pag alam na po yung diagnosis. Thank you po.
Prior to performing the assessment, introduce self and verify client's identity using agency protocol. Explain to the client that you are going to do why it is necessary.
Good day, ma'am. I'm Harley. I'm 17
Discuss how it is to
class. For verification po, can I ask your name?
Justina Yanis.
Birthday po.
November 29, 2005.
Age po. So, I'll be explaining the procedure po first. Interviewin ko po muna kayo for history taking. Then, mag-proceed na po tayo sa nose and sinus. Nagka-allergy na po ba kayo? Nahihirapan po kayo huminga. Infections po and injuries. Nosebleeds. Medication. Change of smell po.
Perform hand hygiene and observe other appropriate infection prevention procedures. Inspect the external nose for any deviations in shape, size, or color and flaring or discharge from the nares. Lightly palpate the external nose to determine any areas of tenderness, masses, and displacements of bone and cartilage. Determine patency of both nasal cavities. Ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. Repeat the procedure to assess patency of the opposite nares. Observe the presence of redness, swellings, growths, and discharge. Inspect the nasal septum between the nasal chambers. Palpate the maxillary and frontal sinuses for tenderness. Document findings in the client's record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.
Yung nose niyo po is pink in color, no discharge, tapos intact naman po yung septum. Nasa midline naman po, and nung pinalpate ko din po yung maxillary and frontal is hindi naman po tender. May questions po po? Ma'am, yung results po, mga 1 to 2 days po, then kakontakin na lang po namin kayo.
Good day, sir. My name is Raymond Gercustasio and I will be your student nurse from APCAS. So before we start, may I know your name, sir?
My name is Guillermo Munoz Cruz.
Then yung age ninyo po and your birthday.
My age is 20 years old. My birth date is December 21, 2008.
Okay, sir. Ano pong gusto niyo pong itawag po sa inyo?
Gil alam ko.
Okay, Sir Gil. I'm going to assess your thorax and lungs. Then yung procedure po na gagamitin natin is palpation, percussion, then auscultation. Sa palpation po, magtatouch po ako ng body parts ninyo. Then sa percussion is magtatap naman po ako ng body parts ninyo. Then yung sa auscultation naman po is to know the body sounds with the use of stethoscope. Sir, pwede po ba akong makahingi ng consent?
Okay po.
Okay, sir, mag-sanitize lang po ako. Close ko lang po yung window, then yung curtain. Po, sir, inspect ko lang po. po, sir, pwede po ba kayong tumayo? Then, talikod po kayo. And then, bend forward po. Okay po, sir. Sa temperature muna po tayo. Then, sa skin integrity. Sir, palpate ko lang po ulit yung sa posterior thorax ninyo para po sa thoracic expansion. Then, inhale, exhale po. Ayan po. Palpate ko lang po yung thorax ninyo para po sa fremitus. Pag naramdaman nyo po yung kamay ko, banggitin nyo lang po yung 1, 2, 3. Okay po, sir? Okay po. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay po. Sir, percuss ko lang po yung thorax. Pa-bend po ng head. Then, pa-fold po ng arms forward. Then sa kabila naman po. Okay na po, sir. Sir, auscultate ko lang po yung thorax ninyo. Pag naramdaman nyo po yung stethoscope is mag-take po kayo ng slow deep breath. Sir, inhale, exhale po kayo. Exhale. Inhale. Exhale. Inhale. Exhale. Okay po, sir. Palpate ko lang po yung anterior thorax, sir. Sir, palpate ko lang po yung anterior thorax para po sa respiratory expansion po. Take a deep breath, sir. Sir, palpate ko lang po yung anterior thorax para po sa tactile fremitus. Sir, papercast ko lang po yung anterior thorax ninyo. Sir, auscultate ko lang po yung trachea ninyo. Sir, auscultate ko lang po yung anterior thorax ninyo. Okay na po. Sir, overall naman po, normal naman po lahat. Anteroposterior diameter po to transverse diameter is ratio is 1:2 po. Then thorax symmetric. And then spine aligned vertically. Then skin intact and uniform color. Then chest wall intact, then no tenderness and no masses. Then full symmetric expansion, then bilaterally symmetric of fremitus. Then low pitch voices of males are more readily and palpated than higher pitch voices of females. Then percussion resonates except over scapula po. Then vesicular and bronchovesicular sounds. Then sa anterior thorax naman po, quiet and rhythmic and effortless respiration. Then coastal angle is less than 90 degree. Then full symmetric expansion po, and thumbs normally separated into 3 to 5 centimeters. Then same as posterior fremitus. Fremitus is normal decrease over heart and breast tissue. Then percussion resonates down to the 6th rib at the level of the diaphragm, but are the flat over areas of heavy muscles and bones, dull over the heart and the liver, and tympanic over underlying stomach. Then yung sa trachea naman po is bronchial and tubular breath sound. Then yung sa auscultation naman po ng anterior thorax is bronchovesicular and vesicular breath sounds. Okay na po sir, thank you po.
Step 1. Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Inquire whether the client has ever had a clinical breast exam previously. Discuss how the results will be used in planning further care or treatments. Inquire if the client has any history of the following: breast masses and what was done about them, pain or tenderness in breast in relation to the female's menstrual cycle discharge from the nipple, medication history.
I'm going to ask you for your history po. Do you have any breast pain? How about mass and lumps po? Okay. Sa nipple po, meron po bang ma-discharge? Wala. Okay po. Have you experienced surgery before?
inspect the breast for size, symmetry, and contour or shape, while the client is in sitting position. Step 6. Inspect the skin of the breast for localized discoloration or hyperpigmentation, retraction or dimpling, localized hypervascular areas, swelling or edema.
Okay, ma'am, inspect ko lang po yung breast mo. Inspect the skin.
Step 7. Emphasize any retraction by having the client.
To emphasize any retraction, ma'am, can you place your hands above your head like this? Next is put your hands together while your elbow is like this. Next is put your hands down on your wrist.
Areola area for size, shape, symmetry, color, surface characteristics, and any masses or lesions. Step 9. Inspect the nipples for size, shape, position, color, discharge, and lesions.
Inspect the areola. Inspect the
Step 10. Palpate axillary, subclavicular, and supraclavicular lymph nodes. While the client sits with the arm abducted and supported on the nurse's forearm,
Can you lift your arm and I will palpate here? Maybe like
Step 11. Palpate the breast for masses, tenderness, and any discharge from the nipples. Palpation of the breast is generally performed when the client is supine. Step 12. Palpate the areolae and the nipples for masses. Compress each nipples to determine the presence of any discharge. Step 14. Document findings in the client record using printed or electronic forms or checklist supplemented by narrative notes when appropriate.
normal body assessment po, the breast is rounded in shape, slightly unequal in size, but generally symmetric. Also, the skin is uniform, same color as your abdomen, and it's smooth in the areola area. It's light pink and rounded. In the nipple, both of your nipple is formed at the same direction. Also, upon the palpation, there is no tenderness, masses, nodules, and there is no nipple discharge. Do you have any questions on that? Wala na po. So, okay ma'am, thank you po sa cooperation.
Prior to performing the assessment, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the results will be used in planning further care or treatments.
Good evening, ma'am. I am Princess Eliza Pinillar, your student nurse for tonight. May I know your name, ma'am? I am Denise Garcia. Okay, ma'am. Can I know your birthday mo? Your heart. And what is your age, ma'am? 18 years old. So, for today po, I will be assessing your heart and central vessels. And can I have your consent po to touch your heart and heart rate?
Perform hand hygiene. Provide for client privacy. Inquire if the client has any of the following: family history of incidents and age of heart disease, high cholesterol levels, high blood pressure, stroke, obesity, congenital heart disease, arterial disease, hypertension, and rheumatic fever. Client's past history of rheumatic fever, heart murmur, heart attack, varicosities or heart failure, present symptoms indicative of heart disease, presence of disease that affect the heart, treatments that affect the heart, and lifestyle habits that are risk factors for cardiac disease. Simultaneously inspect and palpate the precordium for the presence of abnormal pulsations, lifts, or heaves. Auscultate the heart in all four anatomic sites: aortic, pulmonic, tricuspid, and apical. Palpate the carotid artery using extreme caution. Palpate only one carotid artery at a time. Auscultate the carotid artery. Turn the client's head slightly away from the side being examined. Auscultate the carotid artery on one side and then the other. Listen for the presence of a bruit. If you hear a bruit, gently palpate the artery to determine the presence of a trill. Inspect the jugular veins for distension while the client is placed in the semi-Fowler's position with the head supported on a small pillow. Perform hand hygiene. Provide client privacy. Palpate the peripheral pulses on both sides of the client's body individually, simultaneously, and systematically to determine the symmetry of pulse volume. Inspect the peripheral veins in the arms and legs for the presence or appearance of superficial veins when limbs are dependent and when limbs are elevated. Assess the peripheral leg veins for signs of phlebitis. Inspect the calves for redness and swelling over vein sites. Palpate the calves for firmness or tension of the muscles, the presence of edema over the dorsum of the foot, and areas of localized warmth. Push the calves from side to side to test for tenderness. Firmly dorsiflex the client's foot while supporting the entire leg in extension. Inspect the skin of the hands and feet for color, temperature, edema, and skin changes. Assess the adequacy of arterial flow if arterial insufficiency is suspected. Press at least one nail and pad on each hand and foot between your thumb and index finger, sufficiently to cause blanching. Release the pressure and observe how quickly normal color returns, which must be less than 2 seconds. Document findings in the client record using printed or electronic forms or checklists, supplemented by narrative notes when appropriate.
I'm Gianni Corbiana, your nurse for today. And may I verify if you are Juliet Kayanan? And may I confirm if you are 42 years old?
Yes, I am.
Okay. Then, ma'am, I'm going to examine your abdomen to diagnose and if there is any potential illness or pain regarding your abdomen. And in order to assess you, I have to obtain your consent in order to properly assess your health status. And before assessing, may I inquire if you have any past history of the following?
Okay.
Ma'am, do you have any incidents of abdominal pain?
No, I don't have.
Okay. Then, is there any associated symptoms such as nausea, vomiting, or diarrhea?
But nothing.
Then, how about incidents of constipation?
I don't have any.
Okay, then let us proceed to the inspection. May I have the permission to this workshop for inspection, please? for the findings of your abdomen, the skin integrity is considered as normal because it's unblemished skin and uniform in color. And as per the inspection for contour and symmetry, it's also considered as normal because it's planned, rounded, convex, or scapuloid concave. And there is no evidence of enlargement of liver or spleen, and it is also symmetric in color. And as for your abdominal movements associated with respiration, it's also considered as normal because it's symmetric movements caused by respiration dystalitis in very lean people, aortic pulsation in thin people at epigastric area, and there is no visible vascular pattern. And as for the bowel sounds, it's also audible. And as for the auscultation, there is no superficial pain, masses, and muscle carding. And the area above your pubic symphysis is also considered as normal because it is not palpable. And overall, your overall condition about the abdomen is all considered as normal findings. And that's all. Thank you for participating today.
Prior to performing the assessment, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the results will be used in planning further care or treatment. Perform hand hygiene, apply gloves, and observe other appropriate infection prevention procedures. Provide for client's privacy. Request the presence of another healthcare provider if desired, required by agency policy or requested by the client. Inquire about the following: age of onset of menstruation, last menstrual period, regularity of cycles, duration, amount of daily flow, and whether menstruation is painful. Incidence of pain during intercourse, vaginal discharge, number of pregnancies, number of live births, labor or delivery complications, urgency and frequency of urination at night, blood in urine, painful urination, incontinence, history of sexually transmitted infection, past and present. Cover the pelvic area with a sheet or drape at all times when the client is not actually being examined. Position the client supine. Inspect the distribution, amount, and characteristics of pubic hair. Inspect the skin of the pubic area for parasites, inflammation,
swelling, and lesions. To assess pubic skin adequately, separate the labia majora and labia minora. Inspect the clitoris, urethral orifice, and vaginal orifice when separating the labia minora. Palpate the inguinal lymph nodes. Use the pads of the fingers in a rotary motion, noting any enlargement or tenderness. Remove and discard gloves. Perform hand hygiene. Document findings in the client's record using printed
Either po ang straight po ng mga hairs. Tapos naman po sa skin po ng pubic area nyo, impact naman po siya and also normal. So, sa clitoris naman po, rectal orifice and vaginal orifice, normal din siya kasi po, halos po pag hindi po natin ito po sa liver. So, wala naman pong inflammation sa discuss. Sa skin natin also naman po, wala po enlargement or so, wala pa naman po naman.
Good afternoon, ma'am. I'm Juliet Tianan, and may I ask if you are Juliet Tianan?
Yes, sir.
Okay. May I inquire if you have any history of the following? Do you have muscle pain, onset, or location of it?
No, I don't have.
Then, limitations of movement? Or any inability to perform in daily living?
No, I don't.
Then, how about previous sport injuries?
I don't have any.
Okay. Then, how about loss of function?
No.
Okay. Then, that's all. Let us proceed to the procedure.
Okay.
Inspect the muscles for size. Compare the muscles on one side of the body, the arm, thigh, and calf, on the same muscle on the other side. For any discrepancies, measure the muscles with a tape.
How about your height? Okay. Okay. Can you turn your head against the resistance? That's not left.
Then next is, can you shrug your shoulders like this? Things the resistance of my hand. Okay. Can you hold up your arm like this while I try to push it down? Okay. Then can you attempt to push it? Okay. Then next is spread your fingers like this. Then against the resistance of my hand. So next is tap smile, middle finger, and index for okay. Then next is, can you spread your legs against the resistance of my hands? Okay. Then next is, okay. Put up your resist it. Then next is, can you resist? Can you resist? Okay. Have the permission to lift your shirt for inspection. The bone. Okay. When you move your like this, then the next one. As for your examination of musculoskeletal system, all fit is considered as normal finding, and your body is equal in size, and there is no contractures, and also both sides is equal in strength, and there is no deformities or tenderness or swelling, and your joints also moves smoothly. And that's all. Thank you for participating for today's examination.
Thank you.
Prior to performing the assessment, introduce self and verify client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how to participate. Discuss how the result will be used in planning further care or treatments.
Good morning, ma'am. I am Dorely P. Rodriguez, your student nurse for today, and I am assessing your neurological system. May I ask what's your name po, ma'am?
Aya Denise Caralo,
Age po?
18,
Birthday po, ma'am?
January 24, 2006.
Okay, ma'am Aya. Magkaka-skin to skin contact po tayo. Okay lang po ba? And i-assess po natin yung walking nyo and yung eyesight nyo.
Sure.
Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Inquire if the client has any history of the following presence of pain in the head, back, or extremities, as well as onset and aggravating, alleviating factors, disorientation to time, place, or person, speech disorder, loss of consciousness, fainting, convulsion, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory, mood swings, or problems with smell, vision, taste, touch, or hearing.
Ma'am, tanong ko lang po kayo kung sumakit po yung likod ng ulo nyo, tsaka po yung harap nyo. Hindi naman po. Naimatay na po ba kayo? Hindi naman. Wala pong problema sa pang-amoy tsaka panlasa po?
Wala naman.
Sa paningin po?
Wala.
If the client displays difficulty of speaking, point to common objects and ask the client to name them. Ask the client to read some words and to match the printed and written words with pictures. Ask the client to respond to a simple verbal written commands.
Tatanungin ko lang po kayo kung anong object ka.
Ruler po.
Ito po.
Ballpen.
Ito po.
Suklay.
Ito po ma'am, basa po kayo.
The boy is running. The girl is walking. The boy is walking.
Determine the client's orientation to time, place, and person by tactful questioning. Ask the client the time of the day, date, day of the week, duration of illness, city and state of residence, and names of family members.
Ma'am, ask ko lang po kayo kung nahirapan po ba kayo makaalala.
Hindi naman.
Saan po kayo huling gumala?
Sa Donya.
Ano pong last meal niyo po?
Nag-rice ako tsaka tinola.
Breakfast po.
Nag-pillows.
So ma'am, ask ko lang po kayo kung meron po ba kayong injury or kahit ano pong sakit na nararamdaman.
Nagkaroon ako ng asthma.
Kailan po?
Noong November 27.
So, ma'am, count po kayo from 20 to 1.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Next naman po is count po ulit kayo from 20 to 1. Pero, minus po
For
kayo.
lapses in memory, ask the client about difficulty with memory. If problems are apparent, 3 categories of memory are tested: immediate recall, recent memory, and remote memory.
So ma'am, ask ko lang po kayo kung meron po ba kayong injury or kahit ano pong sakit na nararamdaman.
Nagkaroon ako ng asthma.
Kailan po?
Noong November 27.
So,
ask the
ma'am,
client to
count po
repeat
kayo
series of 3
from
digits.
20 to
Example, 7, 4, 3,
20,
regularly
19,
spoken
20,
number of
17,
digits.
16,
Example,
15,
7, 4, 3, 5,
12, 11,
7, 4,
10,
3, 5,
9, 8,
6,
7,
7, 4, 3, 5, 6, 7, 2.
Next naman po is
Until the
count po
class
ulit
fails
kayo
to repeat
from
the series
20 to
correctly.
1. Pero, minus po kayo ng 2.
20, 18, 16, 14, 12, 10, 8, 6, 4, 2.
Sasabihin lang po
Ability to
ang 3 words.
concentrate or
Papaulit
maintain
ko po.
attention span by asking the client to
So,
recite alphabet
the
or to
sky is
count
blue.
backwards.
The
From
door is
100,
brown.
test the ability
The
to
hair is
calculate by asking the client to subtract
So,
7 or
ask ko
3
lang po kung
progressively
paano
from
po kayo
100.
Nag-commute na.
Sasabihin lang po ang 3 words, papaulit ko po din sa inyo. So, the sky is blue, the door is brown, the hair is black. So, ask ko lang po kung paano po kayo nakapunta dito.
Nag-commute ng tricycle and then bus.
So, pakiulit po yung sinabi ko.
The sky is blue, the door is brown, and the hair is black.
Ask the client to recall the recent events of the day, such as how the client got to the clinic. This information must be validated. However, ask the client to recall information given early. In the interview,
Ano pong favorite
example, the
color
name of
niyo
a
po?
doctor.
Brown.
Titignan ko lang po yung mata nyo and pwede po bang lumingin kayo sa side na ituturo ko po. Next, ano pong favorite color niyo po?
Brown.
Ulam po or dish?
Kare-kare.
Pasquis po ng kamay ko.
Gross motor and balance test. Generally, the Romberg test and one other gross motor function and balance test are used.
Ma'am, maglalakad lang po kayo back and forth. Then, close your eyes po. Then, tataas yung right foot. 1, 2, 3, 4, 5. Okay, next po, ma'am. Left foot. 1, 2, 3, 4, 5.
Fine motor test. For the lower extremities, ask the client to lie supine and perform this test. Ask the client to touch your finger with large toe of each foot.
Okay lang po ba kung mag-make contact yung hinlalaki niyo po at saka yung index finger
Yes.
ko? Pwede niyo po ba siyang next? Ay na po. Sabihin niyo lang po kung masakit.
Hindi.
Fine motor test for upper extremities. Finger to nose test. Line to abduct and extend arms at shoulder height and then rapidly touch the nose alternately with one index finger and the other. The client repeats the test. The test is performed easily. Alternating supination and pronation of hands on knees. Ask the client to pat both knees with the palms of both hands and then with the backs of the hands alternately at an over-increasing rate. Finger to nose and nurse's finger. Ask the client to touch the nose and then your index finger held at a distance about 45 centimeters at a rapid and increasing rate. Fingers to fingers. Ask the client to spread arms broadly at shoulder height and then bring the fingers together at the midline. First with the eyes open and then closed. First slowly and then rapidly.
Gayahin niyo lang po ako. Then, close your eyes po. Gawin niyo po sa kabila. Next naman po. Lagay niyo po kami sa Next po, lagay niyo po yung index finger niyo sa nose and then close your eyes. Next.